So, welcome again to another episode of Smiles in the Air, your podcast for oral health and prevention. I'm Celso da Costa. One with me, I have Dr. Khalid Hannouneh. So, coming from the Emirates, just to be with us here in Cologne, Germany for IDS. So, how is the experience till now?
Well, amazing. First of all, it's always a very good occasion to meet in conferences and exhibitions. And this time in the IDS in its 100th version, so it's 100 years for the IDS already, I guess.
Sure.
With this amazing setup from EMS and the GBT, I feel good.
Yeah. For us, the first participation to IDS was in '81.
Wow. Yeah,
so it's been more than 40 years.
Yeah, it's a
long time. So, but one of the things, and I already asked you this 1,000 times, is your life. How you get to be a dentist in Dubai, to be the star dentist that we have today.
Come on.
It's true. Like you are providing really beautiful smiles to the stars.
Thank you.
In Dubai.
I appreciate it.
But you have a particular story from the past that it wasn't easy.
Well, it's not the past. I don't call it the past because it's just a continuation to what I'm doing today is part of how I started. And I appreciate your kind words and your support, but I don't think that I am where I want to be yet. I am on the way. It just started like 11 years ago. I just came to Dubai. My family lives there, but it was accidental. I had a different plan, but life had a different plan for me. So I started from there. I was doing my internship. I did my license. I was working parallel in education and sales with some dental companies. And from there, I did actually my license. I was working in the evening and I was studying in the morning, doing my experience, which was required. And then I started working part-time in a clinic. At the same time, I was doing the other job. Slowly, I started growing. Then I after 3 years, I managed to have my small part in a clinic, where later on I managed to have it all by myself. And I have a partner with me, of course. Now we have another clinic and the third clinic. So we are still doing it. I work 12 to 14 hours a day, you know.
Yeah, I know. I see the text that you send me. Yeah.
Yeah, exactly. So people tell me, like, we saw that you woke up at 7 and you went to the gym, and now it's what, like 11, and you just left the clinic. So, and did you have a break? For me, it's now I can do it. I don't know till when, but I'm passionate about what I do. So I'm happy. I only hope that I will stay healthy as well. That's why I try to work out. Just, you know, our career is exhausting.
That's the thing about you. Humble. That was the first thing. Like you are being the dentist of the stars. You are being this guy lecturing everywhere in the Middle East. You are always finding time to come to these trade fairs and even to exchange message with me.
Yes.
So. Sometimes it's hard to say that you have these extensive hours, but you do it by passion, right?
Yes.
It's kind of a hobby. You need to be honest.
Exactly. Well, I believe happiness. I was thinking the other day about happiness, and I think happiness, when it comes to our careers, is when what you like to do meets with what you have to do.
Yeah.
Or what you love to do meets what you have to do. There is a big difference between what we have to do and what we love to do. And I think happiness when these two things meet. So for me, dentistry is this thing. I feel like I'm doing my hobby. It's like you like to play piano, for example, and then you have to do it for living. And I think this is happiness. Of course, we have our own struggles, ups and downs, stressful. You know, our career is all about the human connection. And people feel honesty. We don't only treat teeth, we sometimes treat souls. People sit with you, they trust you, and you know, in our career the patient should have huge trust with you, to have the submission, to be laying and opening their mouth. This is a very holy area, we know this, and the whole face, but the mouth is something also very critical. And you know, the odontophobia is representing more than 41% of the whole phobias. So the patient has to trust you, and in order to do this, they get in certain psychological relation with you, where sometimes they share even their pain, they share their problems, and you have to listen, and you have to care genuinely, not to show them that you care, not only about how to treat their health and remove their physical pain, but also maybe to just listen. If you don't want to advise, at least listen and be a good listener. So here comes the human part in our career, not only mentioning getting people healthy, but also having this human connection. People feel it, and they appreciate it, you know.
But how you deal with the expectations? Because being like this smile provider, smile maker, and people come and they want like veneers 6 to 6. You cannot do this, or can you?
Well, it will be shocking answer maybe, since that, you know, the aesthetic dentist and the major things I do is veneers and aesthetic dentistry. In 90%, what you see is 10% of the cases that enters my clinic. I refuse a lot of cases. I do reject a lot. I do advise and educate. It's not only rejecting, because if you refuse to do for the patient, they will go somewhere else to do it. But if you refuse and telling them why you're refusing, when they make them understand what are the consequences, if they don't need it, of course. For me, veneers is not an aesthetic procedure. It is a need. And you tell me, how is a need? Aesthetic is a need because some people aesthetically, they really need to change something in them. First of all, because it looks bad to others. Sometimes they are not satisfied with it. And what do you look for when you enter any room? The first thing, a smile.
Yeah.
You don't look for a language. There are different languages. You know, in Dubai we have 200 languages. The first thing you do when you enter elevator, sometime if you want to be friendly, is to smile. And if you don't show smile, you're telling people, don't get close to me. You know. So a smile is the first welcome. It has a huge impact on the people around you. So to have a perfect smile, and you feel that you have it, so it gives you more confidence. You see me when I'm seeing someone, I'm always like, I'm so proud of my smile. So I show it. People receive this positive energy, and it opens a lot of closed doors for you. I have cases and patients, ladies and men, they developed in their career, they developed in their life, they developed in their shape after we fixed their teeth. You know, overweight, they lose weight, they develop in their career, people start seeing them smiling more. So smile has a huge impact. And me doing this thing is always related to me being, do you need it or not? You know, being a smile designer, I don't believe I'm a smile designer. I believe that I'm someone who tries to restore your smile to the best position that it was before you damaged your teeth, or if you had a different scenario with the perfect teeth, that's how it would fit your face. Customization of each experience, you know?
That's where I wanted to come, because I know that you do a lot of this aesthetical work, but I know that you always start with the minimum invasive.
Yes.
You educate people,
yes,
the patient, before getting to this big treatment and this smile makeover. Say like this. So how you do this, and how you implement the minimum invasiveness, and how GBT get inside of all of this?
Well, the minimal invasive dentistry is a concept that people didn't really know before. Now things are changing. People do not only look for a treatment, they want the treatment with the best quality, with the least pain. The patient does not decide if you're a good dentist or bad dentist from the last 2 millimeters you did for the obturation of the root canal. They decide according to how much pain you caused them. Some dentists, they do amazing job with pain, and others, they don't do good job but no pain. Believe me, the patient will say about the one without pain is the perfect dentist. Of course, they will know consequences later. So how do I really education. I mean, our main responsibility as dentists, unfortunately, we turned into mechanics. We drill and fill, and this is not what we are. We are doctors. We are professional care professionals, you know. So we need to educate the patient. We need to sit with the patient and educate them about their life, about what they are doing wrong and bad. And when GBT came, GBT is proving the concept of seeing is believing. I have a lot of, in Dubai we have different nationalities, and I get people who haven't done scaling for the past 6 years, and you see the mountains of calculus. But at the same time, I have some people with extreme oral hygiene, and then they come to you, they say, no, I don't need to do the cleaning every 6 months, I'll do it every 1 year. I tell them, okay, let me disclose. When I do disclosing, I show them, they are like, okay, I understand. because their teeth are perfect, but still they bleed sometimes when they brush in certain areas, you know. And this is opening other doors, because when you disclose and you show the patient the bacteria on a crowded teeth down, the rest are perfect, only the crowded have extra, and he tells me, why here more color than the rest? It's because teeth are crowding. So here comes the necessity for doing maybe aligners. It's not about generating business, but about making the patient understand, why is he bleeding on this crowded canine other than the teeth up and the other teeth. He's doing same cleaning, same person, same flossing, everything, but there are areas out of his ability to maintain. So GBT is helping me see these areas, and it's helping me generate, let's say, it's not about income again, it's about giving the patient advice and him believing it and doing it. And aligners is minimally invasive thing, for example. So I do the GBT, we do the scan, we show them how the teeth might look like, we finish it, and we carry on. Patients do appreciate this, and I'm gonna tell you, people are starting to get more aware of this. I get patients, I do GBT for them first time. Next time they come, they ask me to disclose to see how are they cleaning.
How they are improving.
Yeah, they're testing
or not.
themselves. Yeah.
Yeah.
Exactly. So education is a very important part to do. We have to do it.
For sure. You know me. Like I'm always full on the
Of
education.
course, yeah.
So guys, here you heard from the master. Yes, minimally business. It happens in the static business of dentistry.
Yes.
Education is going to be the most important, and we need to educate the patient. We need to change habits for it.
100%.
So, Khalid, thank you so much.
You're most welcome.
It was really a pleasure to see you again.
It's
here
always a
at
pleasure
IDS.
seeing you. Thank you for hosting me,
for sure.
and I'm very happy to be on this podcast, Smiles in the Air, and looking forward to do it again.
Yeah, for sure. No, we're gonna have a second time.
Habibi, thank you very much.
Thank you. So, for the listeners,
Yes.
don't forget, follow us. You have other episodes. Subscribe the channels on Spotify, iTunes, and even on our YouTube channel. So we are here. We have more episodes coming. So see you soon.